Hello and welcome to Gray Matter, your one stop to all your exam preparation needs. Today we are going to discuss the how to start your PLAB 2 or UKMLA journey. One of the questions that arises in the mind of the students and the doctors that are going to give the exam is how much time do we need to allocate to the preparation before giving the exam and after the PLAB 1. So let's begin. How to begin PLAB 2 UKMLA journey. So according to my opinion, you need about 6 months time between your PLAB 1 and your PLAB 2. The reason is because not only you have to prepare for the exam, and this is a different level of exam. This is not like the PLAB 1, which is a MTQ based exam. This is a clinical exam. It is going to assess your skills, your knowledge, your acting, the way you deal with the patient. So this it requires a lot of energy more than your PLAB 1. So, in addition to this, the visa process, because this exam is going to be conducted in Manchester, UK, so you need to acquire the visa, and for the visa process and to acquire the documents and the relevant documents, the financial statement, you need about 3 months for visa preparation purposes and 3 months for your PLAB 2 or UKMLA preparation. So, in order to understand how to begin your preparation, you need to understand what the PLAB 2 entails. So, the PLAB 2 consists of 16 stations, 2 rest stations, which are excluding the 16 stations. It's going to be roughly about a 3-hour exam, 8 minutes per station, and 1.5 minutes before the station begins, and that's it. And the topics that you need to prepare for exams can be broken down into the medicine part, which include the cardiovascular system, the respiratory system, the neurology system, the gastroenterology system, and the endocrinology, the hematology, the rheumatology, nephrology, ophthalmology, infectious diseases, and dermatology. Now, apart from this, there is going to be the surgery. You need to learn the surgical elements, different topics in surgery. And then there comes the counseling stations. According to my opinion, this is the most important part because this includes 6 to 8 stations. Almost half stations will be from the counseling stations. So, apart from the counseling stations, there comes the ethical stations, which includes the breaking, bad news, the NAI, non-accidental injuries, and and various other ethical dilemmas, the emergency contraceptions, the sick note, which is a very famous demanding stations, and furthermore there are angry patient stations and medical errors. So apart from this, there one station will be your Simmons station, which is basically a station that involves the emergency, your protocol, the emergency procedure that you need to perform on a mannequin. It will not be performed on a patient. Only a mannequin will be present, and the mannequin is a 50,000 pounds mannequin, and it's a very advanced mannequin. You can feel the pulse, you can listen to the heart sounds, the breathing sounds. It talks back to you. So the mannequin is very realistic mannequin. Monitor will be attached to it, so anything that you do, the mannequin will respond accordingly. And then there will be one prescription station in which no patient will be present, only a prescription will be present, and you need to fill that prescription. So according to my opinion, you need to start in the same order as given below. You need to start from the medical stations. You need to cover all the systems first, then you need to do the surgical stations, and then you go for the counseling stations, because the counseling stations entails all of the stations above. You need to use the knowledge that you have acquired from the above stations, and you need to apply it in the counseling stations where you have to counsel the patient accordingly. And the angry patient, the medical error stations, you can do it after the counseling stations, because it's almost similar to the counseling stations. The Simmons station and the prescription station you can do in the last. It's because it does not take much time. And there are also examination stations in which you have to perform the examinations and the procedures. Usually there are 2 or 3 examination stations in the exams, 2 to 3. And procedures, sometimes there's one procedure, sometimes there's no procedure, so it's up to the GMC. And so there you go. This is the way you need to prepare for the exam. There can be some telephone stations in which there will be a telephone present in the room, and you have to converse with the patient through the telephone. And there can be a video call station in which there's a huge TV screen above the telephone, and you need to video call the patient. But don't worry, it's a very huge screen. You can obviously see it, and once you see the screen, you'll know it's a telephone station. When it's a video call station, and in the telephone station there will only be a phone present on the table. So it's nothing to be scared about. The whole structure is almost the same, apart from few things which we can discuss in the later videos. So there you go. So in summary, approximately give 4 to 6 months before your PLAB 2 exam, after your PLAB 1 exam, and do it cover all of these topics, give more focus on the counseling sessions, and you will be good to go. Please don't forget to like, share, and subscribe to the video, and best of luck for your preparation.